Alzheimer's disease. Can this dreaded disease be stopped? I'm Dr. Douglas Street, and today we're going to be discussing Alzheimer's disease. Now, Alzheimer's disease is a type of dementia, and these are conditions of the brain that affects memory, behavior, and thinking. It's a progressive condition, and it eventually affects our daily life. Now, Alzheimer's disease can have a very serious impact on the person that's affected by it and also the family. Now, just imagine you go out on business, you may go to the supermarket and you step outside and you don't recognize where you are. Or can you imagine you have an older family member, a mother or father, they live at home with you, and you go home in the evening after work and they don't recognize you. Or you may go and visit them and they don't recognize who you are. They think that you're an intruder into their home. These are the realities that affect persons with Alzheimer's and the family. And it can be very devastating to the family. Some persons even consider Alzheimer's as being worse than cancer, because the thing about cancer is that you oftentimes can get cure from cancer with treatment. That doesn't always happen, but it can happen to some persons. And when you have cancer, you do still maintain your personality for the most part. But with Alzheimer's is pretty much a uniform, progressive condition, and you tend to lose your personality. So you don't really know what is happening around you, and your family has that burden to take care of that person. So for these reasons, some people actually think Alzheimer's is worse than cancer. Now, Alzheimer's accounts for between 60 to 80% of all dementias. Of course, there are other types of dementias which we'll not discuss during this video. It is a disease mostly of older persons. Most persons with Alzheimer's are over the age of 65, and even that age group, as you get older, it becomes more common. But you do have persons in younger age groups that can have it. In fact, 1 in 13 persons with Alzheimer's are under the age of 65. There are some persons even as young as 45 may start getting symptoms of Alzheimer's. And it is not a rare disease by any stretch of imagination. 10% of males throughout their life develop Alzheimer's, and 13% of females as well, which you notice that women are more likely to get Alzheimer's than men. And this may be partly due to the fact that women tend to live longer than men. So that might be the reason. Now, it is a disease, and it is not to be seen as a normal part of aging. It's not an inevitable thing that you get Alzheimer's. Now, if you are having these symptoms, or if you notice your relative having symptoms of Alzheimer's, then they should go to a doctor and they should have the test done. The doctor may want to do certain blood tests, may want to do scans, and also there are memory tests and so on, which are done just to get an idea as to whether this is Alzheimer's or not. So it's not something that is diagnosed by a family member. It has to be done by a medical professional. Now, what are some of the symptoms that accompany Alzheimer's? During the early stages, there are 3 different stages you could say. The early stages, you start to get minor memory problems, such as forgetting that you've had conversations. So the person who has it, they may ask about the same thing over and over again, not realizing that they have had that discussion already. They may forget about events that have occurred. They may even forget names. They may put things down and can't find them. They may have some difficulties with planning and decision making as well. As it gets later in the condition, the middle stage, you may start to get confused, disoriented. They may not know what time of day it is or where they are. They may get lost in places that are familiar with them. They may start wandering, they may get lost, may go out and can't find a way back home. They may start to have even changes in personality, such as aggressiveness. They may start to become suspicious of family members, paranoia. They may start demand that certain things be done. They may even start believing things that are not true and even seeing things that are not there. They may also have some symptoms of anxiety and depression as well. As it gets later, they may have loss of speech. They may not be able to speak as much. They may speak very little. They may even develop difficulty with swallowing, in which case they may have problems eating. They may need assistance with moving around. They may not be able to take care of themselves anymore. They may need somebody to bathe them, brush their teeth, comb their hair, and they may even start to develop incontinence. In other words, they can't hold your urine and stool anymore, in which case they would need to get proper care. So what are some of the risk factors? Of course, age, as I mentioned, as you get older, it's more common. If it's in the family, it may also be more likely to affect you. So, for example, if you have a first-degree relative with Alzheimer's, that is your mother, father, sister, brother, then your risk may actually double. If it is normally 10%, they may go up to 20%. If you have multiple relatives with it, one or two or more, such as a mother and a brother, then your risk may go up even further. So your risk of developing Alzheimer's, when you have more than one family member, first degree family member that is, with Alzheimer's, then your risk may go up to 20 to 40%. So which is quite significant, right? It may also be caused by certain genetic mutations. It is more common in the chronic illnesses like diabetes. If you have diabetes, then your chance of developing Alzheimer's goes up by between 50 to 100%. Now, don't misunderstand this. It doesn't mean that if you have diabetes, you are 100%, have a 100% chance of getting Alzheimer's. But let us say you are a male with no family members with Alzheimer's, so which means that your risk of developing Alzheimer's is 10%. If you have diabetes, then that risk will go up to 20% or maybe 15 to 20%. So the risk goes up quite significantly. If you have hypertension, if you have had a stroke, if you've had certain cancers, if you've had depression, kidney problems, these diseases, these chronic illnesses, the diseases, especially of the circulation, these can put you at higher risk of getting Alzheimer's. If you've had a traumatic brain injury, especially after the age of 50, then that puts you at a higher risk as well. If you have a poor diet and lifestyle, don't exercise, you eat poorly, you are overweight, you smoke, you use alcohol, and it has been found that persons who have difficulty sleeping also may have a higher risk of getting Alzheimer's. If you live in a place that's affected by air pollution, the cities tend to be polluted because of chemicals in the air. These can also put you at a higher risk, right? So these are some of the risk factors that can make it more likely for you to get Alzheimer's disease. There are treatments that are available, especially in terms of medications, but no must be made of the fact that medications don't stop the progression of Alzheimer's. They may slow down the progression, or they may lead to improvement in some of the symptoms, such as memory, reasoning, and thinking. But the disease will continue despite using these medications. The most common one will be donepezil, but they also have memantine and brexpiprazole. Supportive care forms a very important part of the treatment as well, because as these persons progress further in the condition, they become less and less likely to take care of themselves and their responsibilities. So they will need more and more care as time goes by. And I would say even those who are caring for those persons may need to get some support as well, because it can be very taxing to deal with somebody who has Alzheimer's, especially that person start to become physical, start to get aggressive. Then care is really needed. And of course, they tend not to sleep very well, so they will need 24-hour care. So oftentimes they need more than one person to care for them, one person in the day and another person at night. So this disease can put a big burden on the family. Now, there are some things that you can do to help with the condition, especially if you have a family member with this condition. All is not lost. And especially what they found is that persons who are at the earlier stages, the mild to moderate severity, there are things that can be done. And what they have found is that using an anti-inflammatory diet and lifestyle can really play a big role. So, for example, if you use a whole food plant-based diet, that actually can help very much. And they've actually seen cases where a person have a reversal of the symptoms on this kind of approach. So there are things that can be done. All hope is not lost. They've also found that the keto diet can also lead to a resolution of the symptoms. So if you don't want to try if you have a challenge in transitioning this person to a whole food plant-based diet, then a keto diet might actually be more appealing and can also lead to significant improvement in the symptoms. Dietary supplements may also help, especially those which are not nature-based antioxidants, things like turmeric, for example. Probiotics can also help, because you find that part of the contributing factor to this condition is the intestinal bacteria. So getting a lot of fiber, prebiotics, probiotics, these things can really be very, very helpful. Also, it's important to try and optimize the sleep. That is critical, because as we have discussed, sleep, persons having sleeping problems may be at higher risk for getting Alzheimer's. Exercise, but of course, it may be a little tricky to utilize exercise, because this person may not want to do the exercise. So you have to be innovative. You have to be try using smart ways to get them to exercise. You may take them for a walk to visit a relative. You may take them to the beach, let them walk on the beach, or in a safe way. Of course, use water exercise. These kind of things may actually be quite helpful. Brain exercise is also very helpful. So learning something new, learning a new language, or reading a book, playing games can be very stimulating. Board games, those kind of things can be very helpful in supporting these persons. Social engagement, involving them in clubs and so on, social clubs where they interact with persons. That can be very, very helpful. Getting them involved in church activities, these things might actually be very helpful. And stress management, that is pretty good as well. That's very, very important. And of course, if you're a religious person, prayer might actually be very helpful in helping with stress management. And there are many other techniques that can be used to reduce stress. So in summary, yes, especially if you catch Alzheimer's in the earlier stages, there is a good chance of seeing significant improvement in these persons. And if you can maintain those changes, you may go a far way in helping to resolve this problem. So there is hope. All is not lost. But of course, if yourself or a family member as having the symptoms of Alzheimer's, it's important to get them properly assessed, because other things may cause these symptoms. And then once you've made a diagnosis, then it's important to intervene with these different steps and follow up with the doctor, just to make sure that we are on the right track. Thank you very much, and you have a blessed day. And see you in the next video.